This article is to help the readers better understand diabetes and to provide basic information and skills to appropriately manage the disease. This article gives broad general guidelines on management as well as self-care of diabetes. In this session we will discuss about what is diabetes. In the next session, we will discuss about life-threatening complications of diabetes, long-term concerns, other health issues in diabetes, principles of diabetes management, self-care in diabetes, planning diet, preventing diabetes. If the information in the article varies from what your doctor tells, please follow the instructions of the doctor. What is diabetes? Diabetes is a metabolic disorder. It is said to occur when blood glucose remains high for a good period of time. Among normal people, fasting plasma glucose remains less than 100 mg D1 in 2 hours. After taking food, it rises to less than 140 mg D1. If glucose concentration is detected to be more than 126 mg D1 while fasting for 8 to 14 hours and or 200 mg D1 or more 2 hours after taking 75 gm of glucose, then a person can be diagnosed as a diabetic. The person probably is having diabetes if random blood sugar is in GT 200 mg per deciliter. It is a disease influenced both by genetic and environmental factors. In rare cases, a few other diseases or infections cause diabetes. Diabetes is not an infectious or contagious disease. For want of energy and strength, one needs food based on carbohydrate, protein and fat. In a diabetic patient, carbohydrate and other food are not utilized properly. It is due to inactivity or lack of proper supply of a hormone, named insulin, for metabolic assimilation of carbohydrate, protein and fat. Insulin is produced inside pancreas, an organ lying just under the liver. It must be understood that diabetes is not an infectious or a contagious disease. Symptoms of diabetes. Following are some common symptoms that make one suspicious of diabetes. However, most diabetes, especially in elderly, do not have any symptom or sign and are detected during routine blood examinations. A. Repeated urination. B. Excessive thirst. C. Usually high appetite. D. Emaciation even after taking ample food. E. Tiredness and fatigue. F. Skin disease. G. Rapid loss of eyesight. H. Poor healing wounds. Physical conditions that predispose one to developing diabetes. Following are some physical conditions that predispose one to developing diabetes. A. Being overweight or fat. B. Pregnancy. C. Mental stress. D. Physical stress like injury, wound, surgery. Who gets diabetes? Anybody can develop diabetes, but following types of persons are prone to developing it. A. Those who have diabetes in their family, father, mother, or any blood relative. B. Those who are overweight, and C. Those that do not exercise or perform less or no physical labor. D. Those that have impaired fasting glucose of 111 to 125 mg per deciliter, IFG. E. Those who have impaired glucose tolerance 2 hours after ingestion of 75 grams of sugar, plasma glucose, or 141 to 199 mg per deciliter, IGT. Is diabetes curable? Diabetes is a lifelong disease. Once a diabetic, always a diabetic. However, it can be kept well under control if proper instructions and advice of health workers are followed. A disciplined diabetic can lead a near normal, active and happy life. Types of diabetes. Diabetes can be classified primarily into following 3 categories. A. Type 1 diabetes, insulin-dependent diabetes mellitus. B. Type 2 diabetes, non-insulin-dependent diabetes mellitus. See gestational diabetes mellitus (GDM). Type 1 diabetes. Type 1 diabetes is caused by destruction of body's insulin-producing cells in the pancreas. Type 1 diabetes patients have to take insulin externally because insulin is not produced in their body. Generally, persons below 30 years of age belong to this group. Their body lean and thin. Ketones are sometimes traceable in their urine. Type 1 diabetes can occur at any age, though it develops most often in children and young adults. Symptoms usually appear suddenly. About 5% of people with diabetes have type 1 diabetes. Symptoms and signs: frequent urination, extreme hunger and thirst, weight loss, weakness and tiredness. Type 2 diabetes. Type 2 diabetes generally occur in persons above 30 years of age. Type 2 diabetes has several causes. Heredity, age and weight are important contributing factors. Most people with type 2 diabetes make enough insulin, but are not able to use it properly. Weight loss and exercise can often improve this problem. Type 2 diabetes can develop very slowly. One may experience only mild symptoms or have no symptom at all. One can have diabetes for several years and yet not even know it. About 90 to 95% of people with diabetes have type 2 diabetes. Type 2 diabetes usually develops slowly. Most people with type 2 diabetes are overweight and are over 40 years old. Symptoms and signs: feeling tired, weight loss, blurred vision, dry, itchy skin, increased hunger and thirst, increased urination, tingling or loss of feeling in hands or feet, non-healing infection of skin, vagina and/or bladder, UTI. Sexual dysfunction. Often no symptoms is present when type 2 diabetes is diagnosed. Impaired glucose tolerance, IGT. In some people, blood glucose is higher than in normal person, but is less than a diabetic. Such a condition is termed impaired glucose tolerance, IGT. In an IGT patient, blood sugar following 2 hours of intake of 75 gm. Glucose ranges between 141 mg per deciliter to 199 mg per deciliter. IGT patients should abide by all the regulations of a diabetic because they can face the same complications as diabetes. At least 30% of IGT patients convert to being diabetic at a later period. Impaired fasting glucose, IFG. Some people have fasting glucose of 111 to 125 mg per deciliter. This is termed impaired fasting glucose. These people have increased risks of developing all complications of diabetes than those who have normal fasting glucose, and they must follow same lifestyle measures like a diabetic. Type 1 diabetes. What happens? The body destroys insulin-producing cells in the pancreas, resulting in inability to produce insulin. Type 2 diabetes. What happens? In some people, pancreas starts to produce less insulin, which impair blood sugar from entering cells for its utilization. Usually, insulin resistance make it more difficult for blood sugar to enter the body's cells. Body can't use insulin effectively. Eventually, insulin-producing cells tire out and can no longer perform properly. This is when glucose level rise and diabetes develop. Who develops it? Generally children or young adults, and LT 30 years, but can occur at any age. Risk factors to develop type 1 diabetes: immediate family member with type 1 diabetes, treatment, diet, exercise. All patients need insulin. Who develops it? Generally people who are over 40 years and are significantly overweight. Risk factors to develop type 2 diabetes: family history of diabetes, lack of regular exercise, history of gestational diabetes or giving birth to a baby weighing more than 4 kilograms, high blood pressure and/or high concentration of fat and blood, treatment, diet and exercise. Many people need oral medication. Only some need insulin. Available now at daras.pk all over Pakistan, Bangladesh, Nepal and Sri Lanka.
Duan Digital Marketing, Painmark, The GMAG, Safes Blogs.